Hey guys, Dr. Dave Perna here, chiropractor with back and body pain relief in Springfield, New Jersey. I'm being joined this evening by Dr. David Warwick with Warwick Chiropractic Massage in Lacey, Washington. And before we started recording this interview, Dr. Warwick brought up something interesting, that they were pretty much, I'm in the New York metropolitan area, and actually the Washington area was hit first. So he's a little bit ahead of us with the COVID-19 pandemic. So Dr. Warwick, can you just explain a little bit where you're located exactly?
So if you look at Seattle on the map, we're on the west side of Washington in the Puget Sound. Seattle's like in the middle of the Sound, and I'm about 75 miles south of there. So in Lacey, Washington, which is right next door to the capital, Olympia, Washington. That's our state capital.
What do you recall you were doing, or something that you would reflect upon when you first started hearing about the coronavirus and it possibly coming to the United States?
Well, I did hear about the ship that was obviously out at sea for a while, floating around, and we had this conversation. We were actually in Cabo that week, and Cabo San Lucas, and I said, it's just a matter of time before that reaches here. And obviously it reached our shore first, and in North Seattle is when the first case was discovered at a senior home, and 35 people died from that home out of that, and then it spread from there. So we are now in our third week of dealing with this. So it's not new news to us. Our governor, though, did an excellent job. They did. We knew a lot of this was starting to happen fairly quickly and rapidly in the city, about even for Seattle shutting down. So it didn't surprise me, but we saw this starting to trickle. You just didn't know what to believe or follow in the news of how serious this was getting at some point.
What initial sanctions did the government create? Did you have any shelter in place? What type of restrictions did they put on you guys?
So the restrictions as of Monday at around 3 o'clock is now everything shut down, except, obviously primary healthcare providers, which includes chiropractors in our state. Washington State or Washington Department of Health wanted the chiropractors to remain open to offset the MSK type issues that come up. They don't want to deal with that, but as of, we have currently tent hospitals being set up around the area. There is drive-through triaging to determine if people have or possibility of having the coronavirus at all the local, sister type hospitals that are around and the major hospitals. So, it's escalated to the point that today was the first day that there were hardly any cars out. So
our state, both New York and New Jersey, I'm in New Jersey, but New York also, you started hearing about drive-up testing centers early in the week. I think the hospitals did a smart move, as did a lot of medical offices with, call us, stay in the car, we'll come out and
yes,
triage you so you're not exposing any additional patients. I think that was a smart move by the healthcare providers in multiple states.
Absolutely, yeah.
Because you had all these people possibly coming in with these issues, or even if they didn't have it, at least they weren't being exposed to additional people in the hospitals and medical centers. So that was a smart move. I'm just going to read a quote off I read on CNN. Dr. Deborah Birx, B-I-R-X, she's with the Capitol in the COVID crisis, and she is saying anybody who is in the New York metro area should have a self-imposed 14-day quarantine. And I mentioned this to another doctor. We were interviewing a Dr. Scott Coletti, and I noticed on social media, a lot of people from the New Jersey area were flocking down to their vacation homes or family in Florida, figuring if they're quarantined up here, couldn't go outside up here, they would go to Florida where they could go outside where at least it was warmer, in your yards and and walk around. Have you guys noticed any people flocking to other areas or going to, say, lake houses in your area, trying to just get a little bit more space or a little bit more relaxed area to stay in?
There's been some movement of that, but as far as like touching base with the providers or the patients walking in the office, I'd say more people are stay in place right now and complying with that. I didn't hear like, I'm going to go to Arizona and get out of here. Um, Everyone's been pretty decent in complying that I can tell. The trouble, difficulties we had, people thought it was an opportunity to get out and go to the beaches, and so you have these massive lines of people going to the beach, going to Ocean Shores or Cannon Beach now, because they're off from work, so nice idea, but I think they're really wanting you to stay in place and not be in contact with people.
Yeah, unfortunately, we were dealing with that in New Jersey as well.
Oh,
It was a little bit cold out, but you did see a lot of people go to the beaches. And in fact, a lot of the beach towns were reminding people that the governor here had said stay in place in your primary residence, because a lot of people are going to the beach towns, and the beach towns are off season. So the healthcare staffing down there, the support isn't there. The food stores, simply just the food stores didn't have enough food to supply that many people. The staffing in the food stores wasn't adequate for the amount of people. So it was creating significant problems right now for
yeah.
people just trying to find a different place to go to, a change of scenery from their regular home.
One of the things you brought up, supplies, and while our governor had guaranteed us that there would be no break in the supply chains of movement, we are starting to see the shortages of food. The stores have restricted their hours. You are restricted to a certain amount of food and things because the vehicles and things aren't able to get in and up here now. So this definitely, borders are closed, more restricted there. So I think it's just a matter of time, because I'm already hearing from the nurses and the doctors walking in my office for care. We are short on gloves, masks, supplies, and we are at the point of, and I don't want to say they said this, but I felt like, save your mask, don't throw your mask away. So I want to be really careful in saying they're being told to reuse. Let me not say they use that word, but I could kind of tell that was
Was the suggestion, even though they weren't allowed?
Suggestion, yeah. So I want to be really clear about that no one said we're reusing it, but I got the feeling of that because stuff is starting to dwindle down. In fact, some of the phlebotomists are having to use more, and I'm not sure, the surgical grade or surgery type equipment. They're relying on other equipment now as they've exhausted those kind of things. So there's definitely a shortage that's starting to hit right now.
You had mentioned an interesting statement. You said trucks are having a difficult time getting up there and into you guys. Well, what do you mean by that? Is there restrictions in people coming and going, or is it just is it people don't want to go up there? I mean, what is the reason you're not
timing? I think it's timing. I think stuff is being emptied quicker than the truck delivery times can get up there with the surplus of food or supplies or whatever it is. And this was, oh gosh, it's changed so rapidly. It's amazing. I'm trying to remember just this weekend when I was listening to the news, and this is before we went into, I don't want to use the word lockdown, but I'm going to say stay in place. And we are shut down as a city or as a state right now. We followed you guys actually after that. Because you guys have been locked down now for what, 2 weeks?
Yeah, they don't want to use the word shelter in place. In fact, the governor of New York was a little upset that word was being used. Stay at home was the word they were trying to use more.
That's
they
a
felt
choice
like
of word.
saying, yeah, I think they felt like shelter in place was too much.
Shelter.
Yeah, it was too much of an ominous word, and like we were at war or something. Whereas stay at home just meant let's just all be safe with it for everybody else by
Right.
not leaving the home too much. just so everybody else understands where Dr. Warwick is located, Washington, although was the front runner, unfortunately, in having the COVID-19 and dealing with it first, they're currently third, the third most in state with the third most diagnosed coronavirus issues. New York being first, New Jersey second, if my numbers are correct right now, and Washington is third. So their state is right with it. The only thing is that they were dealing with it a little bit sooner than New York and New Jersey. What actions are you noticing people taking by you at this point? You're as being a week ahead of us. You had mentioned that food is starting to be a little bit more difficult to come by, or at least getting into the stores because there are restrictions. Yeah. So how are you guys planning, your food shopping runs? How is that the day-to-day stuff being affected right
now? As far as that goes, on the personal side of it, we've always had storage of food, because, I never knew if there was going to be a pandemic, but I've been always a saver of things, especially after we had an experience of power without for almost 2 weeks at one time with a major storm that blew through here. So you kind of get where you say, hey, I need to store a little more than just a couple batteries and candles. So for me, it hasn't affected me directly, but as far as fresh produce, maybe not as easily. They are out here, they can deliver the food easily to you. So you can place an order online. There's a delay that we're starting to see, like we can't get it to you for 3 days type thing, or it's not instant when they say it's instant cart. So I think that's the only effect. We haven't ordered anything in the last, since the weekend, so that could have changed recently. And as far as like listening to other patients discuss how it's affecting them, I think you always have two sides that people see it as. Some are seeing it that this is going to be over soon. Others are saying it's doomsday. So it's always interesting in perspective of that, and I think that, there's a lot of fear that's been instilled in people. So I think that has been what has affected the business. And a lot of it's unknown. I think even for you, for me, every are out there, it's the unknown. Like, okay, fine, take me off from work for a week or 2 weeks. Now you're talking about a month, 2 months. We're all talking about you can't sustain that, with a practice, on 50% very long.
No, you can't.
I started seeing this. Yeah, I started seeing this happening. We had it 3 weeks ahead of time. So there was a little bit of prep, or 3 weeks ago, we had a little bit of prep of saying, hey, this is happening in Seattle. It started expanding county to county eventually. And so there was King County, which is more northern. And then you had more of the Pierce County area. And so you can see how each of the counties started shutting down. And we said it's just a matter of time before it hits our area called Thurston County. And so you had time to make some preparations. For me, it wasn't running out to get TP, but other people it was. But for me, it was looking at the business and say, what do I need to do to start preserving some of this, as people were afraid to come in. So, we do what's called screen and clean. We screen people coming in, and then we make sure we have a good cleaning system behind that, including documenting, having the patients answer the questions that I put on the group, and then I put in the chart notes, and we're going to start taking temperature as well.
You mentioned there was a lockdown, right?
Yeah.
But, or however they want to properly say it to not scare people, but is there any changes that have occurred since then?
They gave businesses time to shut their businesses down, other than the ones like primary care providers or hospitals, in that nature. You can go and get basic needs of fuel. I did hear, and I can't confirm this because I didn't watch the televised. I got this secondhand of the governor saying that, and so don't quote me on this, you may have to have a piece of paper or something signed while you're out and about. So I don't know if that's true or not. I would have to check the facts on that, but if I have employees coming to the office or patients coming to the office, I think as of now, I haven't heard anyone enforcing it, especially like state troopers that are in the office. They haven't said anything of how they would be enforcing that at this time.
Yeah, we haven't. It's been suggested to us by certain bodies, governing bodies, that it would be a good idea to give your employees a letter stating that they're part of what's called the essential workforce, and that where they work, and put your cell number on the letterhead. Again, I haven't heard anybody actually have to produce that letter yet.
Mhm.
Hopefully, it'll never get to that point where they are creating like a police state and checking everybody as they come and go throughout the day. And I would imagine we do have a text message system that bring people up to just remind them about their appointment the day before. I would imagine that would
Mhm.
hopefully be adequate evidence that they're going to an office, because it has our time and day that they should be there.
It's also a good tool for you to use if any of you or yourself need to use that text message. Let patients know you're open. So it's a great way to send it out to your base of people, because there's a lot of people that are struggling, just waiting a week. Now they've been hunkered down and saying, I don't know if I can go out, but my back's bothering me. I got a migraine. So some people oh, I'm glad you're open, and they're coming in. Now, is it a full hands on deck? No. But I mean, if 10 or 20% more people showed up at your office or have been calling or want to know, I think it's really a good idea to stay in touch with them almost daily, because
Yeah,
it's quickly.
we put out a text for our New Jersey office that we're in fact still open, seeing patients, and we're part of the essential workforce. And I, unfortunately, in the New York office, the text was at this point we're closed.
Yeah.
The majority of our employees would have to take mass transit in. They have suggested people don't take mass transit at this point in time unless it's absolutely essential. A lot of our staff had voiced their concerns about trying to get in. Not, very few people actually live in the city that work in the city. So most of our people in the surrounding, area, whether it's Queens, Brooklyn, or Jersey City or Hoboken, so they would have to take various mass transit to get in. And there was a discussion amongst my staff a couple weeks ago, towards the end of the week, that this is coming down. It looks like it's getting worse than originally they had said, and collectively they kind of said as a group that we'd feel more comfortable not coming in next week. And I said, if that's everybody's feeling, then that's what we'll do. We'll just be closed for now. And we've been closed for a week and a half now. We're definitely gonna be closed for the rest of this week. It'll be 2 weeks. Then we're gonna have to reassess week to week at this point over there. I'd imagine if we do reopen, we'd have to, like you said, a mass text message
Yeah.
informing people that we're gonna open.
I think this is going to be taking longer than we're expecting. How long, I don't know. And I'm looking at it from a timeline of when we had the first case to where we are now. And I watched how friends were responding back in the Midwest, or people around the country that hadn't been affected. I know you got affected fairly quickly and it spread over, but people are really 2 to 3 weeks behind where we were at still. And I think their response and how they're treating it isn't quite there, unless their governor or mayor are stepping in and saying, listen, take this a little more serious. I don't know, obviously when I go to the CDC or I check Department of Health for the information, some of the symptomatology seems to be changing. Some people, you're seeing some of that information showing different things, like I did have a cough, I had a dry cough, and it turned wet. And, so I think there's a lot of misinformation out there that people really need to look to the primary sources, which CDC is one of them, or your state officials, your state Department of Health. You're probably going to get most best accurate information from that. And I think what I'm seeing is that other people are starting to see, hey, this is more serious than we thought it was. And we were the same way. I go, oh, it's not going to come down this way. I actually had that attitude, and then it did. So I didn't check today, but we were at 10 cases confirmed in our county at this time. But remember, we're south in the Seattle area.
Yeah.
So
I think, you've been doing this for as long as I have, if not longer. And I think we've all seen the worries about various flu seasons, swine flu,
yeah,
SARS, and we've seen them come and go. And we're like, it's going to hit us a little bit. Don't worry. And, it'll be gone. But yeah, this is obviously, and anybody in our age group would probably agree that this is clearly different. The last 10 years, there's always been things in the news where, hey, get ready, this is coming, it's going to be horrible. And, I think that unfortunately did not let a lot of us prepare properly, because they kept screaming, that the sky is falling too many times, or the crying wolf too many times prior to this one. And it just made everybody's reaction be a little bit more delayed than it probably would have been had the other
very
one.
much so.
Yeah.
I would agree with that. And for every flu we get every year, we're not shutting the country down or the world down because of a flu virus. I'm sure they have reasons for the seriousness of these viruses manifest. So,
one last question for you, Dr. Warwick. You tend to be on pretty active in social media with your practice, but have you seen any lashback on like local sites on social media like Facebook, where people are bashing anybody they see engaged outside in group activities? Are you starting to see that? I'm inside. Why are these people outside playing basketball? Or why are they outside all running together? Are you seeing that at all?
I don't see it on the social media as much. We've had some conversation of why are neighbor families hanging together when we're supposed to have social distancing. And maybe they're clear. I don't know. Maybe their kids hang all the time. Maybe I don't know, on that. Not bashing from the social media standpoint. I'm seeing other healthcare providers not understand why the chiropractor is open and having masks on and taking safe measures when there's shortages of supplies, and not understanding here in Washington, we're a portal of entry here. Well, we're a portal of entry anywhere, and that we've been told by the governor, by Washington State, by our state association, remain open. If you choose to close because your numbers are that way, or you have staff that are afraid, or yourself is afraid, not afraid is the right word, you have concerns, if you should be in or not, to do that. But like I said earlier, we are to remain open and be there for service for people, especially as, this may ebb and flow, this virus, and you may see a little backlash. You may have, what I understand, federal is looking at lifting this from us in the next week. Am I right? I believe the White House was trying to lift this. Well, our governor said starting yesterday, strategically, we'll be down for about 2 weeks.
Yeah.
I don't know if that was strategic or not on his part, because he thinks it should be longer. But I'll tell you, at 4 weeks, people are going to get really antsy, and they're going to go out. And so we'll see what the next wave of response is, depending where this virus is at. Probably, I definitely have never seen this in my lifetime.
No.
Nothing like this kind of response. And I've even asked my patients who have experienced World War II, they've never seen this. Some of them experienced the Great Depression, different kind of era response, but nothing like this. And most of them, what I would take away is from my seniors is, this is going to pass. You're going to be okay. I've lived through a lot. I've seen many wars and experiences, and to remain as positive as you can about what's going on.
Yeah, I think they've seen much worse than this.
Yes, they have.
Yeah, I think when the dust settles and this is over, you're going to see and remember, who stepped up to help, who was, acting as a leader and trying to be as helpful to others as you can, and who wasn't there for people when they needed to be. Do you have anything else to add, Dr. Warwick, before we wrap up tonight?
I think this is an opportunity to be vulnerable. And what I say about that is check on your neighbors, check on people, and be a real person. And above all this minutia and news and all that, and show a little bit of heart to what's going on out there, even if it's a simple thing. It goes a long way, especially for people that are experiencing this, that it can be hard and challenging, because there are patients that are trying to figure out, I don't have a job now. I mean, the unemployment here just skyrocketed overnight, literally. And that is a challenge for some people when they were looking at those jobs to pay rent. And so some people are thinking, you know, in the next week, am I going to lose my home where I'm at? So I think those are valid things. So if, you know, you can reach out and help other people, that's probably the best thing that you can do in whatever capacity you can do it in. Remember, these are people too, and everyone's going through this in some way or another, or know someone that's experiencing this. So this is the time for you to step up, even if it's small.
Thank you, Dr. Warwick. So this is Dr. Warwick with Warwick Chiropractic and Massage in Lacey, Washington. Again, I'm Dr. Dave Perna, chiropractor at Back and Body Pain Relief in Springfield, New Jersey. Thanks again, and it was a great talking to you.
Yeah, likewise. Stay safe. See you soon.